Hello everyone. If you are seeing my face for the first time, my name is Adiola and this is Let's Gist with Adiola. I want to ask you a question. Do you really know what causes fibroid? And do you know what food you can use to prevent or for fibroid not to grow further? Please follow me on this Let's Gist to know. This is SGS with Adiola, and let's dive right into the video. In today's topic, we are going to be talking about fibroid, that is myoma. So, what is fibroid? Fibroid are non-cancerous tumor that grows in the uterus of a woman within the childbearing age. The causes of fibroid is not well understood, but the factor include family history of fibroid, obesity, or early onset of puberty. It is not known what causes fibroid, but studies suggest genetic and prolonged exposure to estrogen may increase the risk of developing fibroids. Symptoms include heavy menstrual bleeding, prolonged periods, pelvic pain. In some cases, there are no symptoms. Some may have, some may also have experienced pains in the abdomen, lower back, or pelvic, irregular menstruation, painful menstruation, or spotting, abdominal distension, or cramp, pain during sexual intercourse, frequent urination, period that lasts longer than a week, excessive fatigue, bloating and swelling in the lower abdomen. So those are the likely symptoms. It's not it's not the same, but all these symptoms they are put together. You may experience one or two or three of it, and in some people can be almost everything. Then what are the complications of fibroid? If fibroid left unattended to, these are what can occur after a while. Severe pain or pain that becomes unmanageable. Bleeding, heavy bleeding that requires emergency surgery. Anemia. Heavy bleeding can lead to anemia or lack of red blood cell. Urinary tract infection. Fibroid can press on the bladder, making it difficult to empty. Infertility. In some cases, fibroid can cause infertility. Pregnancy complication. How fibroid can increase the risk of pregnancy complication such as placenta abruption. Fetal growth restriction. When the baby does not grow as expected. Prenatal delivery. When the baby is born before 37 weeks. Kidney dysfunction. In rare cases, fibroid can press on the ureter, which can lead to kidney dysfunction and severe back pain. So these are the complications if the fibroid is left unattended to. So we have types of fibroid. We have five types depending on the location of the fibroid. We have intramural, we have subserosal, we have submucosal, we have pedunculated, and we have cervical fibroid. Intramural, this fibroid grow in the uterine wall, and the most common type of fibroid grows in the uterine wall of the fibroid. Number two is the subserosal fibroid. This fibroid grow outside the uterine wall into the pelvic and can become very large. Submucosal, this fibroid grow in the muscle layer beneath the uterine lining and into the uterine cavity. Then number four, pedunculated, the least common type. These fibroids are attached to the uterine wall by a stalk or stem. And the last one, cervical fibroid. These fibroids are the rarest type, make up only around 2 to 2.5 of all. Is fibroid that is very close to the internal organs, the internal cervix of the uterus. Then what are the tests and diagnosis? A doctor can feel for irregularity in the uterus during an internal examination. Then ultrasound is one of the best examination to check for fibroid. We have trans-abdominal ultrasound or transvaginal ultrasound are about 90 to 99% effective at detecting fibroids. Then we have saline infusion sonography, a magnetic resonance imaging, that's MRI. An MRI uses radio waves and magnets to create 3D image of the uterus. An MRI can help detect the number, location, and size of the fibroid. Then we can also run some blood tests. Complete blood counts or full blood counts can check for anemia, which can cause by chronic blood loss. Other blood tests can rule out bleeding disorder or thyroid problem. Then we have laparoscopy and hysteroscopy. Treatment for fibroid. The best treatment for uterine fibroid depends on the size of the fibroid, the symptoms, and whether the patient wants to have children in the future. Birth control pills can help suppress the hormone growth of fibroid. Hormone blockers, medicines such as gonadotropin releasing hormone agonists can temporarily shrink fibroid by blocking the production of sex hormones. um radiofrequency ablation, a safe and effective treatment that can reduce the size of fibroid by 40 to 70%. It can deliver laparoscopically, transvaginally, or transcervically. Then we have myomectomy, a surgical procedure to remove fibroid from the uterine wall while preserving the uterus. This is a good option for women who want to have children in the future. Then we have hystere- hysteroscopy resection of fibroid, a procedure that uses a tiny telescope and small instrument to remove fibroid from inside the uterus. The procedure is suitable for women who want to have children in the future. And the last one, which is the permanent solution to fibroid, is hysterectomy, a surgical procedure to remove the fibroid totally. This is permanent solution that prevents fibroid from recurring again. It's recommended for women who doesn't want to have children or has attain or complete their family size. That is it on fibroid. So, what are the food to avoid with fibroid? We have animal fat, high fat, dairy products, food high in salt, refined carbohydrates, soy, refined sugar, and caffeine, alcohol. Those are the food that we can run away from if we are having fibroid. The food rich in vitamin E, vitamin B, magnesium, and omega-3 fatty acid may help reduce fibroid symptoms. Pears and apple is an estrogen blocker. Green tea can also help. Hormone therapy is most commonly used to shrink fibroid before surgery. In conclusion, see your gynecologist. So if you find this interesting, give the video a like and a thumbs up. Subscribe to my YouTube channel, and I will see you in my next video. Bye.